Hi everyone, today I am giving you information on the topic blindness. This one is the blindness part 16, in which I'll explain you about the phases of eye camps. Okay, so we had already discussed about the preparatory phase as well as the intensive phase. So let's move to the next phase, which is the consolidation phase. Consolidation phase of 4 to 5 days follows the intensive phase with the following activities. Okay, so it includes the care of operated and the other admitted patients. We will care the operated patients, those patients which are operated after the surgery. Doctor will prescribe the different drops which are needs to be put the patient inside the eye for the 1 month. Okay, and have to taper those drops. Will put those drops time to time in the patient's eye. This was the care of the operated patients, that he or she is not supposed to clean the eye, or water is not supposed to enter the eye. So this one is the care of the operated patient, and some points are also there. And the other admitted patients, we had separate out those patients who have the high blood pressure, who have the different cardiac problems, who have the hypertension as well as the diabetes also. Okay, so take care of the other admitted patients. Next one is the outpatients care, including the refraction. Okay, so those patients which are okay, will check out the vision of those patients, that what is the basic idea of the vision, that how the surgery is done, that what are the basic results of the surgery. Community eye health and the morbidity surveys with the greater emphasis on the school children. Okay, so according to the community eye health, we'll see those diseases which are playing an important role. Okay, so due to which disease the persons get more affected, and our greater emphasis is on the school children, that what is going on in the next generation. So it includes the consolidation phase. Next one is the cumulation and the retrieval phase. On the morning of the last day, okay, each patient is carefully examined on the morning of the last day. Okay, there is a camp of the 7 days. In the morning of the last day, each patient is carefully examined and discharged after proper guidance. Will discharge the patient after proper guidance, that he or she have to taper the drops. Will put the drop 6 times, then 4 times, then after 1 week 2 times, then after 1 week 1 time, and discharge with the proper guidance, that how he or she have to sleep till when the water is not supposed to enter inside the eye, how they have to wash their face. They are not supposed to look out the TV or the mobile phones. So according to the proper guidance, we will discharge the patient and examine the patient at the last day. After this, the man and the material resources are packed up and transported back to the base hospital. Okay, so those things which we have taken from those place have to return all these things to that area, and also uh, relieve the patients to their homes. Next one is the follow-up phase. Now follow-up phase is the last phase. One ophthalmic surgeon with the help of one ophthalmic assistant, one staff nurse and the paramedical personnel conduct the following follow-up examination every 4 to 6 weeks of the closing of the camp. Okay, so basically after doing the camp, after 1 month there is a follow-up phase. Okay, so during this phase, the glasses are prescribed by removing the sutures and the patients are given the necessary advice. So during this phase, the glasses are prescribed to the patients, will provide the proper spectacle power to the patient, and removing the sutures. Those patients who have the sutures will remove the sutures and call the patient for the next time for taking the power of the glasses. Okay, so this was about the follow phase. In this way, we'll do the follow-up, and also provide the opportunity to the patient, that if he or she face any kind of problem regarding their eye before 4 to 6 weeks, then he or she can call us or come to the hospital for their proper checkup. Okay, next one, screening eye camps, reach in approach. Now we had discussed about the comprehensive eye camp. It was the second type, which is the screening eye camp, which is the reach in approach. According to revised strategies, the emphasis is shift to the reach out to the reach in approach. Reach in approach, the screening camps are held in the rural as well as the remote areas. So in this things, those camps are held at the charitable hospitals where the operation theatre facility should be there. Okay, so screening eye camps are held in the rural areas as well as the remote areas where the eye care facilities are not available. So this camp is set up in the rural areas or the remote areas where there are not proper facilities of the eye camps or the eye checkup are available. Okay, patients are provided comprehensive eye care services including the refraction. So here we will set up the refraction unit as well as the ophthalmic unit and provide the facility to the patient of the eye checkup. Patients in need of cataract surgery and then transported to the nearest well equipped hospital. Those patients who have the cataract will make a list of those patients who have the cataract and call the patients to the nearest hospital, to the our hospital, for doing the cataract surgery for free as well as for the less cost. Emphasizing on the extracapsular cataract extraction with the posterior chamber IOL and the implantation of better quality of vision. Okay, so its main motive is to, we will go at the remote areas or the rural areas and collect the patients who have the cataract and do the surgery, okay, for the welfare of the society, for the prevention of blindness. So better quality of IOL implantation is done so that we will give the better quality of the vision to the patients. Many surgeons are now performing the sutureless small incision cataract surgery, which is the SICS, with the posterior chamber intraocular lens implantation. The trained surgeons are even perform the cataract surgery by the latest technique, which is the phacoemulsification in the eye caps. Okay, so these are the different methods of performing the surgery. First one is the SICS. Mostly this SICS is done, which is the sutureless, in which the sutures are not given to the patients. Okay, so trained surgeon can also perform the latest technique by the phacoemulsification, which is one of the safest method and the modern method. Okay, so next one is the documentation, monitoring and the evaluation. A complete and the meticulous record of the patient treated in the eye camps along with the post-operative complications are noted and managed should be kept. Okay, so proper record, there is a need to maintain the proper record, that how many patients we have treated, how many patients we have checked, how many patients we have operated, and what are the post-operative complications after doing the cataract surgery, what were the complications. So all these things are need to be managed as well as noted, and they should be camped. This was all about the result of the eye checkup camp or the screening camp or the comprehensive eye camp. Each eye camp should be monitored by the competent authorities and evaluated in the terms of various activities assigned to the camps and the results obtained. Okay, so each eye camp should be monitored by the authorities. Okay, what we have done for the welfare, so all these things should be counted, which are assigned to the eye camps, various activities to be done, and what are the results obtained. So this one is again very important, documentation, monitoring as well as the evaluation. This was the end. Thanks for your patience listening.